Caregivers who support children and adolescents living with HIV in South Africa need more support. This is according to Dr. Darshini Govindasamy, who is a scientist at the South African Medical Research Council. A survey by the Human Sciences Research Council indicates that the HIV prevalence among children aged 15 years and older in the country remains high, particularly among females. Govindasamy is leading a team of scientists in the trial stage of the Caregiver Wellbeing Plus program. The workshop has trained and financially equipped about more than 200 people who care for their loved ones living with the virus. The research shows that over 1 million children living with HIV in South Africa, with the majority in KwaZulu-Natal. Healthcare professionals say caring for these children can be daunting and difficult, especially for family members who provide hands-on daily care. Issues of stigmatization and depression also impact on how a child responds to taking their ARVs. The South African Medical Research Council is calling for more interventions and government collaborations to expand the program. Dr. Govindasamy joins us now. A very good evening to you, and thank you so much for taking the time to speak to us. If we could perhaps start with a general understanding of the total population of children 15 and younger, or I don't know what the particularly ages that you look at when you talk about those who need caregiving. What is the percentage of them in terms of those who are HIV here in South Africa?
Thank you, Sipiso. Thank you so much for having me on your show tonight. So we're looking at an HIV prevalence of children and adolescents, children themselves 5%, 15 to 19, a prevalence of 5.6% in females versus 3% in males. And that stats is doubled in 20 to 24-year-olds. So that's sort of what the burden is at currently in the country as per the HSRC survey.
I'm just looking at some of what you shared with us, the new HIV survey on progress and ongoing disparities in our country's HIV epidemic. It shows that 81% of people aged 15 and older living in South Africa were virally suppressed in 2022. So are we making an improvement, and is it because there are attitudinal changes? Are people now more accepting that one does not necessarily have to die from HIV/AIDS?
Yes, the country has made great strides in rolling life-saving treatment. However, we have a long way to go in terms of reaching the UNAIDS 95 goals. Whilst we have life-saving treatment, still a lot needs to be done in terms of stigma to get us there. Stigma is still one of the barriers we face in all age groups when it comes to ensuring people stay on their lifelong treatment, and also their well-being is maintained throughout their life course. So 81% great, but still a long way to go in the country to attain those targets.
And you say there's also a pronounced difference in HIV prevalence by sex among the younger populations. Can you also share with us what the distinctions are? And also, if we can look at the racial breakdown. I know often when we talk about this, people ignore the breakdown of by numbers, population in this country. Yes,
so the HSRC survey is a representative survey, household population prevalence survey done in the country. However, as we know, HIV cuts across all race groups in our society and all classes of society. However, the burden still lies with South Africa's Black race group. However, there are definite numbers still within the other race groups. When it comes to these disparities, a large driver here is still our economic inequality in the country and the exposure of women to gender-based violence and the lack of access these groups have to basic health services, particularly psychosocial support, particularly for women and also men in our communities.
And you say this calls for greater focused interventions. By this, what do you mean? And also, if you could just talk about that UNAIDS goal of 95-95 that you were speaking about and why it's improved from 1990. What have been the interventions that have worked?
Mm-hmm. I think what has worked and what's been phenomenal in the country is that we saw an escalation of multi-sectoral responses. So sectors coming together, health, education, social services, with government, civil society, and international donors. I think that investment early on when the strategy was set helped us get there. However, we can see there's needing to be much more concerted effort right now, more intensity with reaching our vulnerable groups, ensuring our LGBTQI plus communities are targeted as well, bringing them into the response and our programs. So just needing much more intensity to reach our marginalized and hard to reach populations to get us there to the targets.
So when we talk about high community VLS, what are we talking about? And also just help us understand when we talk about caregivers for this cohort, are they people themselves who are HIV positive? Do they have a better understanding of the disease, or is there still a need to further educate and equip these caregivers?
Yes, so the caregivers within our Caregiver Wellbeing Plus trial, majority, 80%, are women living with HIV. And the remainder are affected by HIV, be it in their households or communities. Definitely more needed to support these women. They've been neglected and overlooked in South Africa's HIV response. They're needing more support when it comes to disclosure of the child's HIV status to their children and their family members. So they need greater support with that. But they also need support with dealing with their own internalized stigma before they can even get to that. So they need places where they can come together and see other women just like themselves in their community, and they can feel a sense of belonging and get that support and upliftment from other women. I think that is critical more than ever. They are just needing a group, a form of psychosocial therapy to get them through some of the daily struggles they face, be it coping with the grief of a loved one, the daily stigma that they face in their communities and by their family members. So I think that is sort of the focus of this, and also just needing a lot more support to get them out of the financial difficulties that they are faced with. Currently, the economy making it very difficult for these women to get into the labor market. So needing these women to be targeted with economic empowerment interventions to help them find ways in which they can start their small businesses in the communities, link up with other women and other people that can uplift them in their society. And I think that's critical.
And what about funding, especially given if you look at programs like PEPFAR, whose funding has been dwindling over the years, who are favoring more direct community contributions? Are those being channeled to the right programs, the right places? How else are programs such as yours going to source funding?
Mm-hmm. I think the missing link to channel these programs is the need for data, both effectiveness data telling us what is working, but also cost. To be able to know where to direct these programs better, one needs to know, what's the bang for the buck? How worthwhile is that intervention? And I think that can draw a lot of attraction to investors, international and government, because, we work in a setting where we know budget is scarce and there's competing priorities. So our project itself is trying to generate that data. We are basically collecting data that can tell us, is this program effective and is it cost effective? What would it take government to scale up that intervention? What would it take donor partners to come in and scale up something like this? So I think there's definitely attention, but in order to drive that and get funders drawn into that and to be looking into this more, we really need to supply them and have the data to show them, come invest here. This is a vulnerable population, critical for the future of South Africa and Africa's economy. And I think that will produce better buy-in, because there's definite demand. In our project, we have shown there's demand. This vulnerable group of women come to these economic empowerment sessions. And I think if we can couple that with the investment, I think we can have great benefit for our society.
Thank you for your time, Dr. Darshini Govindasamy, scientist at the South African Medical Research Council.